Welcome to Hit Show, your go-to source for today's leading healthcare business headlines. I'm your host, Rhonda Brooks. It's Thursday, October 16th. Coming up today on Hit Show, the nation's largest healthcare strike enters day 4 as Kaiser Permanente workers hold the line across 3 states. Jefferson Health announces sweeping job cuts tied to post-merger financial stress, and Cleveland Clinic links arms with Silicon Valley investors to bring new medical innovations to market faster. Later in the show, how Google Cloud is quantifying the ROI of GenAI and how IKS Health is applying agentic AI to clinical workflows. All that, and a preview of Logan's upcoming interview with Aashima Gupta, Google Health's global health leader, just ahead of Health 2025. Let's go. We begin with the continuing strike at Kaiser Permanente, now entering its 4th day and affecting facilities across California, Oregon, and Hawaii. Logan Stokes has the latest.
RHONDA, this is the largest healthcare labor action of 2025, with more than 30,000 frontline staff, including nurses, medical assistants, and techs, demanding higher pay and improved staffing ratios. Kaiser officials say hospitals remain open using contingency teams, but some elective procedures and specialty appointments are being postponed. Union leaders frame the walkout as a fight over safety and burnout, warning it's not just about wages, it's about sustainability of care delivery itself.
Logan, what are you hearing about how long this might last?
Negotiations resumed late Wednesday, but union reps say they're prepared to extend the strike through the weekend if progress stalls. Kaiser maintains optimism for a resolution, but even short disruptions like this ripple through the system, affecting everything from elective revenue to employee morale.
Another major system is making hard decisions of its own. Jefferson Health is cutting jobs as part of its ongoing turnaround plan. Teresa Vaughn reports.
That's right, Rhonda. Jefferson Health announced it will eliminate roughly 650 positions, or about 1% of its workforce, primarily in nonclinical areas. The Philadelphia-based system, which merged with Einstein Health in 2021, has faced persistent operating losses amid inflation and payer lag. CEO Dr. Joseph Cacchione says the move is aimed at strengthening Jefferson's financial foundation while protecting patient-facing roles. Analysts note that many academic systems are in the same position, squeezed by contract delays, wage growth, and capital costs, leading to a new wave of restructuring.
Teresa, is this part of a broader trend among teaching hospitals?
Absolutely. From Boston to San Diego, we're seeing systems consolidate administrative layers and delay capital projects. Jefferson's move fits a national pattern, cutting quietly now to avoid deeper reductions later.
While some systems are retrenching, others are leaning into innovation. The Cleveland Clinic is joining forces with Khosla Ventures to commercialize new technologies faster. Logan has that story.
Exactly, Rhonda. The Cleveland Clinic Innovation Group has partnered with Khosla Ventures to co-fund, incubate, and launch early-stage health tech and biotech ventures born inside the clinic's R&D pipeline. The partnership combines clinical validation with venture capital speed, providing startup teams with both data and domain expertise. Initial focus areas include AI-enabled diagnostics, surgical robotics, and new care delivery models that can scale beyond Cleveland.
That's an unusual pairing. A nonprofit health system and a Silicon Valley VC firm.
It is. Khosla Ventures is betting that medical-grade innovation needs better translation into the commercial world, and the clinic wants faster access to funding mechanisms. Both sides say this could become a template for how large providers incubate technology going forward, a trend we'll likely hear more about next week at Health.
In Pennsylvania, another affiliation is reshaping the provider landscape. Teresa, tell us what's happening with Heritage Valley.
Heritage Valley Health System has agreed to join Allegheny Health Network, expanding AHN's reach under the Highmark Health umbrella. The two systems say the merger will bring shared specialty coverage, unified EHRs, and greater regional capacity. Local leaders are pitching it as a win for care access, but expect regulators to look closely at the competitive impact in Western Pennsylvania.
And on the West Coast, another integration milestone.
UCSF Health has completed the full integration of St. Francis Memorial and St. Mary's Medical Center, finalizing governance and EHR unification across both hospitals. The system says the move strengthens its footprint within San Francisco and improves continuity between academic and community care settings. It's part of UCSF's ongoing expansion strategy, blending world-class research with accessible local care.
After the break, Google Cloud releases a major report showing AI agents are delivering real returns within the first year, and we'll hear how health systems are putting multi-agent workflows into production right now.
HITshow is made possible by EY, a globally connected, multidisciplinary professional services organization driven by innovation and action for the long term. An optimistic future where business, people, society, and the planet thrive. EY can help you shape the future with confidence.
Welcome back. You're listening to HITshow. Google Cloud just released its second annual ROI of AI report, and the results confirm what many health system leaders have been betting on. Nate Collier has the story.
73% of healthcare and life sciences organizations are seeing positive returns on their AI investments within the first year, according to Google Cloud's new report. But here's what's driving those returns: multi-agent systems. 44% of healthcare executives already have AI agents in production, with 34% launching more than 10. These aren't simple chatbots. They're sophisticated systems that plan, reason, and execute complex tasks like prior authorizations and clinical documentation. Hackensack Meridian Health is a prime example. Chief AI Officer Samir Sethi says their clinical note summarization tool, rolled out in June, has helped 1,200 clinicians generate over 17,000 summaries across 12 specialties, freeing up pajama time and reducing burnout.
So the ROI isn't theoretical anymore. It's showing up in workflow efficiency and clinician satisfaction. Thanks, Nate. Now, one company that's leaning hard into this multi-agent approach is IKS Health. Anika Shah reports.
IKS Health announced a new multi-agent platform built on Google Cloud that automates high-frequency back-office tasks across the entire patient journey. The system can detect when prior authorization is required, prep charts for claims, and use ambient listening technology that integrates directly with Epic and other clinical systems to help with documentation. The company says the AI agents can autonomously handle up to 80% of routine tasks like insurance approvals and document processing, with human oversight when medically necessary. Founder and CEO Aashima Gupta says they're eliminating point solution friction to create a connected care platform that removes the administrative chores from clinicians and care teams.
That 80% figure is striking. It's no longer about pilots. It's about production scale. Thanks, Anika. To close out our Google coverage today, Logan Stokes spoke with Aashima Gupta, Global Director for Healthcare Strategy and Solutions at Google Cloud, about what's driving this shift.
Aashima, thanks for joining us.
Hi, Logan. Thank you so much for having me here today. Looking forward to catching up with you in Las Vegas.
So this report shows some impressive numbers. What's really driving this ROI that health systems are seeing?
So I would start by saying the conversation in healthcare has shifted entirely. AI is no longer just a tech project. It's a business strategy conversation. 44% of healthcare executives already have AI agents in production, and nearly half of them are dedicating over 50% of their future AI budget to these agentic systems, because you can't fix complex, multi-step workflows like revenue cycle or like prior authorization or scheduling with a simple chatbot. That's why the market is pivoting to agentic systems that can orchestrate these complex tasks.
And you've outlined 3 levels of AI maturity, 1 being simple chatbots, 2 being agents that can act like specialists. What about level 3?
Level 3 is where it gets interested. It's multi-agent workflows where multiple agents work together, collaborating and orchestrating the entire process flow. And it's happening because now we have 3 big components. We all have used LLMs, but this is multi-agent architecture. It has 3 things. These agents have agency. They act. their ability to execute actions in external environments like calling an API or database or an EHR poll gives them this ability.
The workforce crisis keeps coming up. How does this help?
Google's ROI of GenAI report confirms that 73% of healthcare life sciences organizations are seeing positive returns within the first year by leveraging sophisticated tools. We are using AI agents we are seeing being used in the industry to alleviate administrative burden and streamlining workflows. There's a term in the industry, much of the industry burnout is reading and writing documentation. We call it pajama time. Every 2 hours being spent on the pajama time for 1 hour of patient care. There's a WHO study that says that there will be shortage of 10 million healthcare workforce by 2030. So how are you going to address that? We need to look into freeing up healthcare professionals to focus on what matters most, the patient care.
Aashima Gupta with Google Cloud. Thanks for your time.
Logan, thank you so much for having me today.
Looking forward to more implementations at Health, and yeah, I'll see you in Vegas.
That's all the time we have for today. Thank you for joining us on Hit Show. If you liked these stories, please follow us on LinkedIn and check out our in-depth feature videos on hit.show. Hit Show, your go-to source for healthcare business news, can be found all the places where podcasts are heard. Please join us again tomorrow for the latest headlines in healthcare. Hit Show is made possible by Kimchi. Transform your team with an agentic AI workforce that creates, optimizes, and distributes marketing content while keeping the human touch. For an AI workforce powered by you, kimchi.com.